Hello and welcome to the research course. I'm very excited about the summer and glad that you're being a part of this course. I do want to go over a few things with you. I recommend that you take a look at the syllabus first of all, find out about the various assignments that will be due this semester, and also the course requirements in terms of papers and projects that's written down on assessments, and there are some discussions it'd be helpful to get over. And take a look at those things before you get too far into the class because some things are due right away. Today my plan is to go over the PowerPoint. I'm going to be just kind of talking through it, reading through it some places to get this information to you. If you don't find audio helpful, don't feel like you need to listen to these. About the same, obviously the same information you're going to see in terms of the slides. But I thought for some people that it's very helpful to listen, and this way they can both listen and see if that's a benefit to you, then this is a better way to go than just looking at it. So for today, we're going to look at a variety of different terms, differentiate about what is the difference between a problem, a purpose, and a question of a study. And this is all, of course, talking about research. I'll describe the question in terms of a research question and hypotheses that relates to the research process. Also applying critiquing criteria to the evaluation of the research question and hypotheses, and then identify and define researchable questions in terms of one's own nursing practice. Describe priorities and mechanisms which have been developed by the National Institute of Nursing Research. You'll hear people talk about NINR. That's what they're talking about. And then finally, differentiate between the nurse's role in research according to education level. What an associate degree nursing grad is expected to know upon graduation in terms of research is much different than a doctorate, and it's also different than someone who has a master's or a bachelor's degree, and we'll talk about that at the very end. So some of the terms that you're going to see throughout this semester are terms like research problem, research purpose, research questions, research hypothesis, statistical hypothesis, dependent variables, independent variables, testability, directional hypothesis, and non-directional hypothesis. And we'll go over these in the next, I think about 26, 27 slides. First of all, you hear people talk about a research problem, and what a research problem is kind of just something that seems to need some additional work. It might be a foundation of a research study. It might find some gaps in the nursing literature, like we don't really know what to do here, so that would be, and we need to know, that would be a research problem. They're usually pretty broad in terms of how they're said. They're usually not exactly stated within a research article if you're reading it, but you can kind of figure out by the end. Examples of research problems might include medication errors by nurses are a significant cause of patient mortality and morbidity. So kind of like, why do we have nursing errors? What's going on with that? It's a problem. Prostate cancer poses a significant health concern for men and their families, or families are thrown into crisis after a natural disaster resulting in emotional, social, and financial problems. So what do we need to know and what do we need to do about these problems? So then you move on to the research question, which is more specific than the research problem itself. And frequently stated in a research article, you might see the research question was. Research questions are used in quantitative studies, and you'll hear a lot about quantitative and qualitative research being a little bit different. Quantitative, just to kind of go over it quickly, focuses on more statistics, numbers. You expect surveys in quantitative research in which people might figure, say, well, how stressed are you on a scale of 1 to 5? How with qualitative tends to be more exploratory, tends to be more interviews, might be some discussion groups, that kind of thing is how the data is collected, and it's more of a discovery process than what people think of as a real scientific research project. In terms of examples of research questions, the quantitative research question might be something like, do the educational backgrounds of hospital RNs predict patient mortality beyond factors such as nurse staffing and experience? While qualitative, remember, the more exploratory might be, what is the parent's experience of living through a natural disaster? Or what's the child's experience of living through a natural disaster? More exploring what's the lived experience is often what qualitative focuses on. So there's a variety of sources of researchable questions. So where do they come from? Oftentimes nurses will see some patterns. It's like, you know what, I just keep on seeing these kids have problems with school once they've had, you know, cancer and cancer treatment. What can we do about it? Sometimes the nurse might be reading the literature and go, you know, I just can't find anything about this, and I think this is really important. And that might be where a researchable question comes from. Other things, there might be untested theories. There might be a nursing theory, and it's like, well, you know, this is really nice for this person to say, but I don't really experience how that is in real life, so let's test it. And there may also be other disciplines that have theories that might apply to nursing. I do a lot of research on education, and so I use a lot of educational research theories in my research and less in nursing, and that's perfectly fine. At least I think so. Anyway, development of a research question. First of all, some sort of, like I said, some sort of idea emerges or issue or problem. Usually the nurse will think about it, might talk to friends and say, you know, this is what I'm thinking, what are you thinking, kind of do some brainstorming. Literature review, looking at what does the literature say. You know, if you have an idea, it's like, oh, I really want to find more about it, and then you open up and start looking at different databases and find, wow, there's actually a lot in there that you may not have known about. It might not be worth doing the study. Then take a look at what are the variables, what I need to be concerned about, and what I need to consider as I develop this research project. And then the formulation of research questions. One needs to kind of decide, all right, what are we going to do here, and what direction we're going to go in. Because sometimes what starts off in the very beginning is an idea, the idea emerges, and it kind of transforms and morphs into different things, and getting that down so we can really focus on, right, this is what we're doing here, can be very helpful. As the questions are developing, one wants to think about, is this a significant issue to nursing? Is it a clinical or is it a theory? If, you know, no one's really going to care about the research, no one's going to really do it, or in terms of applying it, why bother? So one needs to consider about, you know, what is the worth? Because research takes time and it usually takes money. It's just even photocopying and transcribing and getting people to do things, it still adds up. So one thing to think about too is, you know, is it worth the time? Is it worth the money? Do we have that? If someone wants to maybe like research Nevada nurses' feelings about ethics and practice, and they want to use some sort of postcard, going to cost a lot just to get those postcards out, and then to get that data back and get it all figured out is something to consider about. And then who are the subjects we're going to be using? Later on in the semester we'll talk about students, well, and also patients, and who are vulnerable groups. We have to be particularly careful when we work with people who might be considered vulnerable, such as people with disabilities, mental or physical, women who are pregnant, people who are in jail, and we'll talk about that later, and special rules. And then the testability. Can we actually figure out what we want to? Say we want to look at some sort of research that is looking at the feelings of a person who has autism, who's not able to speak. Well, it's going to be really hard to figure that out. We can do some observations, but we really don't know. It's a lot into interpretation. So, you know, maybe we need to look at what are the physical signs of maybe anxiety or stress or happiness or things like that, and not try to get into that person who is not able to communicate. So testability. Can we really figure out and go forward in this as a consideration? About components of the research question, there's going to be variables. Variables are things that we consider. For example, you might say, what is the stress level of single mothers with 2 or more children? Stress level is the dependent variable. That's kind of what we're looking at. And the independent, the things that we're kind of evaluating, are single moms with 2 or more kids. So we might want to take a look and see, you know, is there a greater amount of stress if single moms have 1 kid? So we might want to have a study group that has one kid, and then one that has 2 or more, and then evaluate the stress levels and do a comparison between those groups. We also want to figure out what is our population. Who are we looking at? In that case, we're looking at single moms who have children. But sometimes we might want to look at cancer patients. We might want to look at people who've been through stress or had surgery or something like that. Not all studies will have independent and dependent variables. For example, all the qualitative studies, you're not going to see it. You might see what is like the lived experience of an ER nurse. I was reading recently an article about nurses in the ER and their feelings of intuition. And how they used intuition in their practice really doesn't have an independent and dependent. It's not really a strict research in terms of experimental design project, but still research in terms of it's a qualitative research asking questions, just not with independent and dependent variables. We'll go over that more, but I do recommend that you know those two terms, independent and dependent variables. If I was you, I would have a little card and I'd write those two words down and have a good definition and use that, because those are words that are going to come up again and again, and I promise you it will be on a test. So I really recommend that you know those two. All right, in terms of developing a clinical question, similar to the research question, you're going to take a look at the clinical situation, what's going on, what don't we have answers for, and then use that to look at the literature, and then take a look at those the population, the intervention, the comparison intervention, and the patient outcome. So you hear people talk about PICO. Who are you studying? What are you doing with them? Who are you comparing with them? And then what happens to those two groups? Does one get better? One get not so good? What are the differences? And that is a very common practice of clinical research studies. When you hear people talk about the purpose of research, it's usually to generate answers to a question, to provide a basis for direction for future studies, and it's to communicate the nature of the problem. So you might hear people say, the problem is, and the research process is, and our purpose is. A lot of times those aren't stated, though. It's kind of just implied. In terms of quantitative, usually things that are being evaluated as, is things effective? And they'll look at different strategies and compare them. And they might look at relationships between variables. But like I mentioned, qualitative research, discovering, exploring, describing might be, how does a mom deal with the stress of losing a baby? That would be more of exploratory. We're not doing anything to the person except to figure out their experience and try to understand that. In terms of examples of research problems, purpose, and questions, I recommend you go to your study guide on page 495, and you can see about what is a research problem, where is the purpose stated, list the research questions. And like I said, sometimes when you read a study, it doesn't really say what the research problem is, but you have to kind of figure that out. What are they studying and why? And that can be very helpful. So take a look, Appendix C, describe the research problem, list the study purpose, list the research question. If you, I know this week you're supposed to start looking for a research article. You might, as you're looking through the abstracts, try to think, what is the research problem in this? What is the purpose? Are there research questions stated? And think about that as you're reading, and that will help you understand these and get a better grasp of these concepts and find a really good article, because the more specific you can find, the easier it's going to be on you. So research questions and hypotheses. You'll hear people talk about what are the questions of the study, and it's kind of almost like it's a little more defined than the research problem. And so it's a little bit narrower, indicates more kind of where you're trying to go with a study. And a question might be, will organizational restructuring affect the delivery of competent nursing care? So it's asked in a question. There's a question mark at the end. While a hypothesis is usually a statement, no question. It's like organizational structure will result in decreased medication errors by RNs. So it's like, where you're going. It's a statement of fact. In reality, it's really not fact. It's just kind of what you're going to be testing. But you'll see both of these used in research. Hypotheses, you'll see though in the quantitative research studies, and they explain and predict, and usually have some sort of anticipation of an outcome. While research question and quantitative may include a more descriptive hypothesis generating sort of where are we going. The qualitative, once again, exploratory and little is known about the topic. When to use a hypothesis testing. Depends on what you're doing and what you're exploring. Sometimes it's better than other times. Research questions I think are really helpful in letting the reader know where you're going. Sometimes the statement of hypothesis just doesn't feel right to me, and I understand the process, but I enjoy questions more than I like hypotheses. But you'll find if there's a causal relationship between things, or you believe there to be, that a lot of times a hypothesis will work just fine. Usually there's no right and wrong in terms of one or using the other. It kind of, once again, depends on what study you're doing. Is it a thesis? Is it a dissertation? You're probably going to have those. Research for an article in a journal, usually they don't require you to have one or the other. It's up to you. It does provide a bridge, though, the hypothesis between theory and reality. It's objective, it's more direct, it's less kind of wishy-washy than the research problem and where we came before. Some things with the hypothesis, there needs to be relationship. You want to have those variables, this, and say who you're studying, making sure it's testable. I recommend that research is theory-based, that you have some sort of theory in which you are studying. Might be like a bigger one like stress theory or adaptation theory. Could be educational theory, but it's very helpful to study theory, and it helps provide direction, and we'll talk about that another time. Once again, the components are trying to talk about what are the variables, what are the issues, who's the population, and who are you studying, and then predict what's going to happen. It says the statement that way. You can have ones that are directional or non-directional, but you do need to consider about the relationship with nursing theory and how does it fit in. You will hear people talk about a statistical hypothesis or a research hypothesis. Usually in nursing research particularly, a research hypothesis is much more common than a statistical. And we'll talk about what those are a little later. Many studies include more than one hypothesis or research question. They might be looking at, for example, I was talking to some nurses who wanted to look at doctors' relationships to nurse practitioners. They may want to look at the nurse's relationship to nurse practitioners' relationship to physicians, but they also may want to look at physician assistants' relationship with a doctor. So there might be two. What is a relationship between the nurse and the doctor, or the PA and the doctor? And maybe a third might be, is there a difference? And those would be research questions. A research hypothesis specifically would be that there may be something like there is a more positive relationship between physician's assistants and MDs than nurse practitioners and MDs. That would be, it's a statement, you're telling a direction. Some studies, like I mentioned, might have both a hypothesis and a research question. Quantitative usually have the hypothesis. You will not see a hypothesis in a qualitative study. So at the beginning I talked about the National Institute of Nursing Research. The purpose is to enhance research in general and training in research to improve health and illness across the lifespan, focus on health promotion and disease prevention, the quality of life, health disparities, and end-of-life issues. And the ways they do this is provide information and also money to researchers to help them develop their research and their experience in research. All right, I have a couple of questions for you. First one is a matching, and it says, so you take a look, read the statements on the right, or sorry, on the left, and then match it to the right. And so first is, now in terms of nursing process and research, who would be should be knowledgeable of the consumer of research? Be a knowledgeable consumer of research. So basically saying they understand what research is about and be able to use it. versus the next one, promote the integrity of research into clinical practice. Third, demonstrates an awareness of value of nursing research. And then finally, collaborates with experienced researchers to develop study design and methods. So which of these associate, bachelor's, master's, or doctorate do you think would do either of these? And what it's asking for is the higher level. So think about that for a minute, and then we can move on. All right, so next, the BSN graduate should be, oh, I think I skipped one. Here we go. Another one matching. Who should be developing methods of scientific inquiry? Who should be assisting others in applying nursing science and knowledge? Who should be designing and conducting research studies and identifying nursing problems, needs, and investigations, and assist in data collection activities? In terms of who would be the highest level for in their role would be be appropriate. For example, would you expect an associate degree nurse to design and conduct research studies? No, I would hope not. They don't have the training or abilities to do that. They might be smart enough, but they don't have the knowledge and training. But they could assist in data collection activities. So read over those and then decide on which is most appropriate. In terms of the bachelor's nurse, where you should be a knowledgeable consumer, that was down there, able to read research literature critically. And that doesn't mean just like, oh, that one sucked, I didn't like that one, but saying, you know, what are the good parts of this and what are the bad, what would I have done differently, and how can I use that? That's what it's looking at. Then you can also use research in clinical practice. So you can go, oh, okay, I can see how this could be used in what I do. Your job is also to protect research subjects, and you should not be conducting research on your own. At some hospitals, they might have you work with someone with a master's or doctorate, but for a bachelor's nurse to design a research study and implement it is going to be hard in terms of being able to know everything that needs to be. I'm not saying that bachelor's nurses aren't smart enough, but they usually don't have the skills to be able to do that without assistance from others. So that is the first lecture, and I hope you enjoyed it. I hope you learned a lot, and you will continue learning. Bye now.